So this makes perfect sense to me why I wasn't seeing what they were predicting, which is these respiratory patients coming into the ICU. Who was I seeing in the ICU? I was seeing people with dementia, as we talked about, diabetes, kidney disease. These are the ones that were sick. The other thing that really hit me and resonated with this was, and this was not even controversial. We knew early on in the pandemic that people who came into the hospital and had higher levels of vitamin D did really well. They didn't die. They didn't have the same chances of dying. People who had low vitamin D levels, they had much higher levels, chances of dying. So we would check these vitamin D levels. And so think about this. You're there at ground zero and you're taking care of these patients and you see this data over and over and over again, that vitamin D is very predictive of who's going to die. Obviously, what are you going to do? Even though this is an associative study, that association doesn't mean causation, you're going to be giving people vitamin D and try to get those levels up. The problem is that we gave vitamin D and it really didn't have much of an effect.